Bonjour, bienvenue à notre conférence de presse. Welcome to this media availability. We'll start with Minister Hajdu.
Well, hello, everybody, and thank you very much for joining us here today. I just want to start with a thank you for the Auditor General's overview of the Public Health Agency of Canada's response to the pandemic from the beginning. I will say that this, like all other countries, Canada has been learning, growing, and changing as we've learned more about the virus. And certainly we've invested millions upon millions of dollars into the Public Health Agency of Canada and billions of dollars into provinces, territories, and of course, through direct support purchasing a variety of equipment and therapeutics, including vaccines. We continue to evolve our response as we learn and grow. And I will say that the fall economic statement commits $690 million to the Public Health Agency of Canada to continue to bolster our response. I'll also say that since the beginning of the pandemic, the agency has grown by about 1,000 individuals. This reflects the size and the strength of the agency at this point in time, given the ongoing needs for Canadians of a strong public health response. So we fully accept the Auditor General's findings and, of course, agree with the recommendations that a much stronger focus on public health and pandemic preparedness must be part of Canada's plans now and into the future.
Good afternoon, everyone. I'm William Blair, the Minister of Public Safety. I'd like to begin by thanking the Auditor General for her report, and I was very pleased that the Auditor General recognized the strong response of the Canadian Border Services Agency, and specifically, the Auditor General found that border restrictions were quickly enforced. The CBSA acted quickly to provide guidance to the border service officers on restricting entry to Canadian citizens, permanent residents, and essential workers, and that the Public Health Agency of Canada and CBSA worked collaboratively together to develop guidance for border service officers and our BSOs. The CBSA had a pandemic plan, which it further developed as the pandemic evolved, and that is the reason why, well before the pandemic was actually declared in Canada, CBSA was able to swiftly implement new measures for our border operations. I'd like to take the opportunity to acknowledge CBSA and in particular, our frontline border service officers for their remarkable work throughout this entire pandemic. Since the very beginning, border service officers have shown great adaptability in implementing the provisions of 45 orders in council, which were designed to restrict travel and reduce the spread of virus and its variants into Canada. With respect to the Auditor General's report, I want to acknowledge that the consistent application of these new border measures across all ports of entry can be improved. And that's why we accept the Auditor General's recommendations for CBSA. I note that the agency already began, since the auditor concluded her examination last June, to take action to address the deficiencies identified. And for example, they have expanded their support to frontline border service officers. They have conducted detailed technical briefings prior to the implementation of new or amended orders in council to support the accurate implementation of the new provisions and ensure clarity for frontline workers. And they are developing a new training tool to further assist frontline officers in understanding the complexities of those orders in council. CBSA will continue to consider the findings and recommendations from this audit report, and they will be informed in all future strategic planning and policies decisions by the advice of the Auditor General. They'll continue to ensure that critical infrastructure and essential services, as well as critical economic supply chains, continue to function normally and as required by all Canadians. And I also want to assure the Auditor General that CBSA will continue to work closely and follow the guidance and advice of the Public Health Agency of Canada and our many other partners in keeping Canadians safe. Thank you.
I think that means I'm up next. I'd like to thank the Auditor General for her review of the Investing in Canada plan, which commits more than $180 billion over 12 years for infrastructure that benefits Canadians. En ce qui concerne la mise en œuvre du plan, nous sommes sur la bonne voie et nous respectons les délais. Over the past 5 years, the federal government has invested more than $81 billion for over 67,000 projects, with 90% of them completed or underway. That means 40% of the way into the plan, we've invested over 40% of the funding. While the Auditor General found that the full budget of the plan was accounted for, she noted that we needed to do a better job of showing our work, and I agree. Talk to any mayor or city councillor across this country about how these projects are improving their community. From new Canadian-made electric buses in Brampton, Ontario, to the new McLaughlin Point water treatment plant on Vancouver Island, to the Net Zero Aquatic Centre in Drayton Valley, Alberta, to new high-speed internet in Eskasoni First Nation in Cape Breton. Je suis témoin de ces réussites et d'autres encore tous les jours. Et les Canadiens doivent pouvoir voir l'argent durement gagné des contribuables. We can't just build back better, we have to build back smarter. That's why we've launched engagement on Canada's first ever national infrastructure assessment. We will rely on experts, data, and evidence to identify Canada's infrastructure needs and priorities out to 2050. By getting projects approved quickly, reporting transparently, and focusing on outcomes, we can use our infrastructure investments to promote jobs and economic growth, to improve quality of life for all Canadians, and to drive towards a net zero emissions future. Thank you.
Good afternoon, everybody. It's my turn. Bonjour tout le monde. It's a pleasure to be joining you this afternoon from the traditional territory of the Tsawwassen and Musqueam First Nations. Our government welcomes the Auditor General's independent report on the Canada Emergency Response Benefit and recognizes the importance of its findings and recommendations. It's hard to believe, but today marks exactly 1 year since the COVID-19 Emergency Response Act, which created the CERB, became law. La PCU était une prestation historique qui a guidé plus de 8 millions de travailleurs et leurs familles à payer leurs factures, leur épicerie et leur loyer. Tout cela à une époque où on demandait aux gens de rester à la maison et d'apprêter la corde. Public servants at CRA and ESDC worked tirelessly to deliver for their fellow Canadians, and we thank them. We all know a Canadian who got support through the CERB, whether that be a spouse, a sibling, a friend, or a neighbor. We delivered this major income support program to help buffer some of the hardest economic circumstances we've faced in a century. And we did it despite not having the usual time required to design, analyze, and implement a new benefit of this size. The public service pulled off this historic feat in a matter of weeks. This report is a testament to the expertise and knowledge within the Government of Canada, as seen in its findings on the level of analysis and advice provided before the launch of the CERB. This due diligence set us up for success, allowed us to make adjustments to the benefit in real time, and ensured it continued to respond to the evolving crisis. Guidés par le principe de ne laisser personne de côté, nous avons continuellement cherché comment nous pouvions mieux soutenir les travailleurs et rendre plus de personnes éligibles. A prime example of this is when we introduced flexibilities to allow workers to make up to $1,000 per month while collecting the benefit. This allowed Canadians to stay attached to the workforce while also bringing in income for their families. And we kept tabs on the trajectory of the pandemic and the related labor market changes, extending the CERB twice, on June 16th and then on August 20th. We were also able to adjust the CERB to develop risk scenarios to identify and detect high-risk applicants. This allowed us to stop payment for more than 30,000 potentially fraudulent applications valued at approximately $42 million. At a time when so many Canadians are making sacrifices, it has always been important that we make sure our support goes to those who really need it. Comme je l'ai dit dès le début, nous accueillerons favorablement les recommandations de ce rapport. Work is well underway on CERB post-payment verifications. A boost in funding from the Fall Economic Statement will help us take further action to detect, investigate, and address cases of fraud related to the benefit. And lastly, we will be undertaking a formal assessment of the CERB for future reference during an emergency situation where a response and recovery benefit would be needed. This is similar to how we use lessons learned from the SARS crisis of 2003 during this pandemic. À mesure que nous progressons dans notre relance économique, notre gouvernement continuera d'être là pour soutenir les travailleurs. Merci.
Bonjour à tous, c'est maintenant mon tour et comme on le dit, on garde le meilleur pour la fin. Donc, ça me fait plaisir d'être avec vous aujourd'hui. Le Bureau du vérificateur général du Canada vient de publier 2 rapports portant respectivement sur la subvention salariale d'urgence du Canada et sur la prestation canadienne d'urgence. Ces mesures ont été mises de l'avant par le gouvernement du Canada pour soutenir les particuliers et les entreprises en cette période difficile. Concernant le rapport portant sur la subvention salariale, l'Agence a eu l'occasion d'examiner les constatations du BVG et de fournir des commentaires sur les recommandations proposées. L'Agence s'engage à mettre en œuvre les recommandations énoncées dans ce rapport, notamment en renforçant l'observation fiscale et en utilisant l'intelligence d'affaires pour effectuer les vérifications. Les vérifications sont actuellement en cours et se poursuivront afin de s'assurer qu'il n'y ait pas d'abus du programme. Pour ce qui est du rapport portant sur la PCU, l'Agence s'engage également à suivre les recommandations du BVG en ce qui concerne les prochains travaux de vérification de la PCU. L'Agence établira un plan de vérification et effectuera ces vérifications lorsqu'il sera responsable de le faire. Bien que la plupart des Canadiens respectent leurs obligations fiscales, il est important de mentionner que l'Agence a mis en place des mesures pour limiter les demandes frauduleuses à ses programmes d'urgence et elle continuera de le faire. Depuis le début de la pandémie, l'Agence s'est engagée à maintenir un équilibre entre rendre les fonds d'urgence accessibles aux Canadiens dans le besoin, tout en préservant l'intégrité et l'équité de notre système fiscal. L'Agence continuera de travailler avec le BVG et les intervenants pour améliorer continuellement ses programmes et les services. Et l'Agence le fera en continuant de mettre de l'avant les principes de leur modèle de service, les gens d'abord. Je vous remercie à tous.
Merci beaucoup, Ministre Lebouthillier. Nous allons maintenant commencer la période de questions. Once we're opening, we'll now start the question period. As usual, one question, one follow-up. Comme d'habitude, une question et un suivi. Operateur, could we please have the first question on the phone?
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. La première question de Raymond Fillon, TVA. La parole est à vous.
Merci. Good afternoon. Question for Minister Hajdu. How do you explain the Public Health Agency wasn't better prepared to deal with the pandemic last year?
Well, thank you very much for the question. There's quite a bit of reverberation here in my voice, so I'm sorry if I'm sounding a little confused. The Public Health Agency of Canada was a relatively small agency. And in fact, since the report study timeframe has concluded, we've expanded the agency by more than 1,000 employees to date to bolster our capacity in a number of critical areas. And this just reflects, I think, the challenge of such a heavy operational lift without the appropriate level of staffing, the level of expertise. You know, we had about 10 to 12 fully qualified quarantine officers. These are healthcare professionals that have additional 6 months training on the specifics of the Quarantine Act. And in fact, now we have 200 quarantine officers. And of course, recruiting during a pandemic, trying to recruit healthcare workers is a significant challenge as well. But I will say that the agency has learned many, many things about the need to constantly be refreshing pandemic planning, not just within the agency, but certainly driving that pandemic planning as a whole of government exercise.
Now, I understand the agency has grown since the pandemic began last year, but the auditor today says it should have been better prepared at the onset of the pandemic. How come it wasn't?
Well, listen, I think worldwide, there's a challenge in how we balance our investments in health. And coming from local public health, I can say that that's been a challenge at provincial and municipal levels. There's always a need to spend on healthcare delivery, but public health is often not recognized as necessarily an equivalent need. And so I think this is the reflection that the agency and, in fact, the government and governments around the world are having the need to invest in public health, which is about prevention and health protection, and is often the poor cousin of health spending overall.
Thank you. Operator, next question.
Thank you, merci. The next question is from Catherine Lévesque, La Presse canadienne. La parole est à vous.
Yes, hello. My question is also for Minister Hajdu. Did the lack of preparation from the Public Health Agency cost Canadian lives in the end?
I can say that the Public Health Agency was preparing from the original indication of pneumonia of unknown, I guess unknown pneumonia. That, sorry, the reverberation's terrible. Can the tech people please help tone that down? Maybe I'm going to try again. Oh, that's much better. Thank you. I can now hear myself think. So when Dr. Tam was alerted to a pneumonia of unknown origins at the end of December, in fact, she began that preparation work that included alerting medical officers of health from across the country and standing up the special advisory committee very quickly so that the country could begin to prepare. Of course, listen, every country, as I said, is going to be reviewing lessons learned, and there will be a full review of the Public Health Agency of Canada and the government's response as a whole. But I can confidently tell you that Dr. Tam and the entire Public Health Agency of Canada knew that this was a health threat to Canadians and knew that we needed to begin our preparations, not just at the federal level, but certainly as a nation. And that is exactly what happened.
And
Suivi,
at the
Catherine?
same time, it was also, oui, absolument, merci. At the same time, it was also Dr. Tam who had to say that the threat was not low anymore, that the threat was very real and for Canadians. So I'm kind of wondering why it took until March 15th, I believe, for Dr. Tam to chime in and say, look, the threat isn't low anymore. Can you explain why that happened, basically? Thanks.
Well, I think, one of the reflections I've had as a Minister of Health is that there is a difference between individual health threat and country health status threat. And certainly in the early months when we had little to no disease activity, COVID disease activity here in Canada, the threat was indeed low to Canadians, individual Canadians here in Canada. But of course, as we started to see cases rise, that threat assessment was under constant review. And every step of the way, we have listened to our public health leaders, including Dr. Tam. And when Dr. Tam made the assessment that indeed the threat risk to Canadians of contracting COVID-19 was rising, those threat risks were changed accordingly.
Merci, opérateur. Prochaine question.
Thank you, merci. The next question is from Ryan Tumulty, National Post. Please go ahead.
Yeah, hi there. The Auditor General, in the period that she looked at, March to roughly the end of June, found that nearly 2/3 of the people that were supposed to be quarantining, that PHAC couldn't guarantee that they were. I'm wondering, since that time, have those numbers changed? Do you have updated numbers on how effective PHAC is at monitoring people who are supposed to be under quarantine?
Maybe I can start, and I'll maybe ask Bill Blair to add a little bit because we've worked together on this very closely. In fact, yes, we've seen an improvement of our capacity to be able to do door knocks and direct checks on people quarantining. But I will say that our evidence shows that since April 1st, 2020, when mandatory quarantine was implemented, in fact, 96% quarantine compliance rate, 98% quarantine compliance rate based on law enforcement activity since April 1st, 2020. And, we had over 2 million verification calls since March 8th, over 70,000 in-person visits. So yes, our numbers have increased significantly in terms of contact with travelers, but I will take this opportunity to thank the vast majority of Canadian travelers who did comply with quarantine. And we're understanding of the need to follow the appropriate mandatory quarantine measures to protect themselves and their communities. I will also say the ArriveCan app has been mandatory since November of 2020, and that ArriveCan app has significantly helped us. Having digital tools like ArriveCan has significantly helped us to monitor people's whereabouts and their quarantine plans, and to be much more thorough and targeted in the way that we use our policing partners who are, really collaborating with us at all levels of policing to make sure that we do appropriate checks on those folks that we feel are at risk of violating quarantine. And I'll turn to Minister Blair to say a few more words.
Thank you very much, Mr. Hajdu. And just in furtherance of that discussion, the Auditor General found quite accurately that as of the end of June, for example, the ArriveCan app only had 7% of travelers using it at that time. We did make it mandatory, exactly as Minister Hajdu said. And now, and I'm very pleased that now we're at 89% of travelers are using the ArriveCan app, which allows us to collect this information digitally. That allows us to share that information with the Public Health Agency of Canada and police of jurisdiction and other law enforcement agencies in order to ensure compliance. And I think there's also very good news. As you're all aware, we've implemented some very significant, rigorous new measures just this year. And for example, we now require people in both land and air modes to provide us with either pre-boarding or pre-arrival testing, so that they must have a negative test taken within 3 days of their arrival at the border. We've also implemented very significant new post-arrival testing regimes for both land and air, and we're following up on quarantine enforcement. And the numbers are very encouraging, and I think it's important to acknowledge. We now measure 99.6% compliance with our testing, screening, and quarantine regimes that are being enforced, and 89% of that's being done digitally. And so there's been a very significant improvement in our ability to measure compliance. I think it's also an opportunity for us to acknowledge Canadian travelers who have accepted these requirements for their return to Canada in order to protect themselves, their families, and their communities. And the level of compliance that we are seeing is very, very encouraging, and it's working.
Follow up, Brian?
Yeah, I'm just wondering, the other thing that was in the Auditor General's report when it came to pandemic preparedness is a real weakness in data collection and data sharing between the provinces and the federal government. It seems like this is something that goes back, frankly, decades. I'm wondering, if you plan some sort of renewed effort to get the provinces and the federal government on the same page when it comes to collecting data on the pandemic, because that seems to have been a real weakness here.
Well, thanks very much, Ryan. And I'll agree, it's been a very frustrating aspect of managing the pandemic. For example, in the early days, we would often get submissions of cases from provinces and territories without anything beyond potentially age, potentially gender, really no disaggregated data whatsoever, and very hard for the federal government to be able to track what's going on. And I'm pleased to say we've come a long way since then, and we've had a lot of progress with provinces and territories and rapid transmission of data on disease activity, on cases, on genomics and sequencing, and a lot of collaboration on tracking the virus in general. And that's in a large part, I think, due to the Safe Restart money that we committed and that we've dispensed to provinces and territories, the $4.28 billion in the Safe Restart that was specifically dedicated for data sharing, improvement, and modernization of data management. In addition to that, of course, the $500 million for rapid support to healthcare systems for provinces and territories, many of them could use and did use that to augment their capacity to get data shared quickly with the federal government and with their other partners. So, there are silver linings, I think, to crises. At least some people see it that way. And one silver lining might be, I think there's a couple. One, that the provinces and territories have rapidly adapted to virtual care, and so have been able to, achieve getting care to people in very, very hard to reach corners of the country. But the second silver lining in terms of healthcare is this improvement in data sharing. Is it perfect? No, but we've come a long way. And I think it certainly has highlighted for all partners the value of having processes and structures in place to share data electronically and quickly.
Thank you, operator. Next question.
Thank you, merci. The next question is from Mary Kay Walsh from the Globe and Mail. Please go ahead.
Good afternoon. Thanks for taking my questions. Minister Hajdu, you seem to be suggesting in your answers that, Canada never had the capacity for preparedness for pandemics, and that this is all kind of new, and then that's why we were so ill prepared. But the Auditor General makes very clear that Canada didn't use the systems that it had created, like the GPHIN. And so I'm just curious as to how you account for that. How do you account for the fact that the stuff that was created after SARS and that was built up in public health was not used to better prepare Canada for the pandemic and to provide actual early warnings on risks, and not a week after the WHO declared a pandemic and a week after Italy was already in a countrywide lockdown?
Okay, I'll take part one of that question. Certainly, in terms of GFIN, I would just steer you to the interim report of the expert panel. The GFIN program issued two different kinds of reports. One, a daily update that does a tracking of all kinds of different stories on diseases or issues of concern that related to health around the world. And secondly, what's called an alert. And indeed, the alert system did go dark, but the alert was actually for international partners. So the daily reports did arrive every day. And in fact, Dr. Tam, as I mentioned repeatedly, and as the interim report confirms, knew at the end of December about the cluster of pneumonia-related cases that were from an undetermined cause, and took immediate action to begin alerting the system, alerting her provincial counterparts, and standing up the beginnings of a framework to respond to what potentially could be quite a significant risk to Canada, and obviously eventually became a significant risk to Canada. So it's really important to understand that although GFIN was not providing those external alerts, and certainly the independent report and the panelists believe that that has extreme value to our international partners and to the global public health information network as a whole. Internally here domestically, in fact, those daily reports were continuing, and Dr. Tam was alerted very early on to this unusual occurrence of pneumonias. And so that is when, as I mentioned, her coordination of her colleagues began. In terms of why was the Public Health Agency of Canada not better prepared from a staffing and operational perspective? I think I've been very clear that the challenge, I think, always is around valuing prevention and protection as much as we do the delivery of healthcare, direct healthcare. And certainly, as the Auditor General report indicates, that we have to do both. We have to keep our eye on supporting excellent healthcare delivery across the country, and we have to have a robust public health system at all levels of government, including the federal government. And those recommendations of the Auditor General are a confirmation of what I personally believe as a person who has spent many years in public health at the local level. And I can tell you our government is taking very seriously, which is why you see the massive investment in the fall economic statement of almost $700 million that will go towards ongoing support for the agency's COVID response and for continuing the rebuild of the Public Health Agency of Canada to the degree that it's necessary to protect us from an event like this in the future.
Follow-up, Marika?
Thank you for that response. I didn't hear your explanation for how it was that Canadians were still being told in March that the risk was low, but I need to ask Minister Qualtrough, I believe, my next questions. I don't know if Minister Hajdu wants to weigh in again after that. Minister Qualtrough, I'm going to ask you this because my French is not good enough to ask Minister Lebouthillier, but can you please speak to the capacity and the type of audits that the government will be doing of both CERB participants and the companies that participated in the wage subsidy to ensure that money that might have been wrongly given to participants or companies is clawed back? What specifically are the plans on that front?
Well, hello, and thanks for the question. I'll focus on the CERB, the wage subsidy. I suspect my colleague can give you a more fulsome answer. ESDC and CRA have been working very closely together for since the onset of this benefit. Post-payment verification activities were always contemplated as an element of the benefit delivery, moving some of the integrity measures to the back end so we could deliver the CERB more quickly within 3 days was definitely a conscious choice on our behalf. And now, as we work to investigate cases for example, on potential fraudulent claims or on people who applied in good faith but didn't actually end up being eligible. We're still waiting for a lot of 2020 taxes to be filed. Madame Lebouthillier can tell you a little more detail on the analytics and the investigative tactics, if you will, of CRA, although as you can appreciate, some of that is confidential by design. But we are working on a number of fronts, both to focus first on people who took advantage of vulnerable Canadians and applied fraudulently under mistaken or false identity. And then, of course, just to work very systemically through the CERB applicant role and determine who, and just clear up any potential claims that may have been inaccurate or inappropriately applied for. There's an entire process that we knew we would undertake from the beginning, and we are methodically going through that. Diane, est-ce que tu as d'autres commentaires?
Oui, je pourrais compléter concernant la subvention salariale où il était important pour l'Agence du revenu de pouvoir trouver un équilibre entre la vérification et l'accès aussi de l'aide aux entreprises. Puis je voudrais rappeler que les entreprises étaient vraiment en détresse. Donc, les programmes qui ont été mis en place ont vraiment étaient là pour faire en sorte de garder le lien entre les employés et leurs employeurs. Et nous avons mis aussi des sanctions où on a avisé là, au niveau des personnes des entreprises qui recevaient la subvention salariale, où on peut, il va y avoir des remboursements s'il y a des gens qui ont fait de la fraude. Il va y avoir de fortes pénalités aussi. On parle de 25% de pénalités supplémentaires pouvant aller jusqu'à des peines d'emprisonnement. Donc, au niveau de la vérification des programmes qui ont été mis en place par l'Agence du revenu, je peux vous dire qu'au cours des prochaines années, tout sera fait et pour faire en sorte de récupérer les argents qui sont allés vers des gens qui auraient et qui pourraient avoir bénéficié de façon frauduleuse. Mais je peux vous dire que la grande majorité des entreprises, quand on a mis les programmes en place, autant au niveau des Canadiens et des Canadiennes, des employeurs et des employés, étaient vraiment pour aider les gens à passer à travers la période de pandémie. Merci.
Merci, opérateur. Dernière question.
Thank you, merci. The next question is from Christopher Nardi from the National Post. Please go ahead.
Yeah, the first question, I'll address it to, I guess, Mme Lebouthillier, maybe Mme Qualtrough, but Mme Lebouthillier, je suis curieux quand même. Le rapport souligne que plusieurs des mesures de vérification que, même si vous auriez voulu les mettre en place à l'ARC pour ces programmes-là, vous n'auriez pas pu parce que vous avez des problèmes, encore une fois, avec la façon que vos données sont compilées ou même que vous ne les avez pas carrément. Et c'est un problème qu'elle dit est catégorique, systématique depuis avant la pandémie et qui va perdurer après la pandémie si on ne l'adresse pas. Qu'est-ce que vous allez faire là, pour finalement adresser ces enjeux de données à l'ARC pour qu'on puisse finalement avoir ces enjeux-là, ces problèmes-là de régler?
Écoutez, comme je l'ai mentionné là, dès le début, on se rappellera que l'économie s'est fermée le 13 mars 2020 et le 6 avril 2020. Déjà à 6 heures le matin, on pouvait déjà commencer là, à fournir des argents aux Canadiens et aux Canadiennes. On devait avoir des programmes qui soient simples et qui soient flexibles pour pouvoir répondre aux Canadiens et aux Canadiennes. D'avoir mis beaucoup plus de critères en place aurait fait en sorte qu'on n'aurait pas pu répondre aux Canadiens et aux Canadiennes. Donc, pour nous, au niveau de notre gouvernement, c'était vraiment important que les gens puissent payer leur épicerie, puissent payer leur logement. Il fallait sécuriser les gens en cette période de pandémie. Puis on l'a dit, c'est la plus grosse crise qu'on a vécue depuis la Deuxième Guerre mondiale. On était vraiment sur le champ de bataille et on va continuer de faire en sorte, on va faire l'analyse de ce qui s'est passé dans les programmes qui ont été mis en place et je peux vous dire qu'au niveau de l'Agence du revenu, on va s'assurer d'avoir, nous aussi, dans une éventuelle prochaine pandémie ou prochaine grosse au niveau des changements climatiques, que ce soit là prochain gros événement qui vient toucher la population, nous aussi, au niveau de l'Agence du revenu, on va avoir notre trousse de survie pour pouvoir aider de façon beaucoup plus efficace les Canadiens et les Canadiennes et les entreprises.
And on a somewhat related question to what Marika Walsh was saying just earlier, the plan, according to the Auditor General, is that in 2023, some of the verifications are finished, I think, by CRA, March 2023, and then ESDC has a 4-year plan to do post-verification audits or verifications up until, anyway, 2024. But I want to understand, what does that mean? Does that mean that your audits on both ends will be completed by 2024 at the latest, or is that just we're going to identify the problematic cases and then be able to begin the audits, which generally can be a long and grueling process?
Yeah, I'll start. Thanks for the question. Listen, we have to put in place a multi-year plan because as people file their taxes, as people's taxes are reviewed by CRA, of course, there may be change. So we need to have the ability legally to continue on with this post-verification work. Of course, the vast majority of it will be done sooner, but we need to have in place the structures to look at these cases. And as you said, some of them will be very complex in terms of particularly the more sophisticated fraud, which we don't even know yet what that could or may have looked like. We needed to put in place a framework, both legal and policy and administratively, to have the runway that's long enough to follow up on all of these, wherever these threads kind of take us, both to ensure Canadians that we're doing the due diligence we promised we would do after the fact, but also to show and learn more about our own kind of risk-based sophistication around mitigation of this kind of fraud.
Thank you. That concludes this press conference. Merci. Cela fait fin de la conférence de presse. Bonne journée.